Welcome back. On the 29th of October 2013, the World Health Organization reported that the first case of polio since 1999 had been detected in Syria. And on the 5th of May 2014, the Director General of the WHO declared that the international spread of polio is a public health emergency of international concern. Only the second time that the global organization has ever issued such a declaration. With the 24th of October having marked World Polio Day this year, medical experts representing UNICEF and the WHO, two organisations at the forefront of combating this deadly disease, gathered to share the results of the regional and global efforts being undertaken to eradicate polio once and for all.
Polio is coming for me. It needs warm bodies like mine. Because without it, it will die.
Polio is a highly infectious disease caused by a virus that invades the nervous system and can cause total paralysis in a matter of hours. Affecting some of the most vulnerable people in the population, the disease mainly preys on children under the age of 5, with 1 in 200 infections leading to irreversible paralysis.
The symptoms of the disease usually start with what we see with any flu-like symptoms, diarrhea, vomiting, fever, and body aches, but then it moves to a sudden onset of paralysis. And so one day you'll see your child walking and running and like any other child. The next morning, he might not be able to walk. It's that fast. And for some parent to see that such sudden, take of a child's life from them in front of their eyes, it requires you to act immediately. So it's not something you can ignore. The reason why polio is different than a lot of the other diseases is because polio is near eradication. So what we see is that globally, since 1988, in 1988 there were 360,000 cases of polio reported from 125 countries. So that number of cases spread all over the world. And then the initiative, the Global Polio Eradication Initiative, started in 1988 with a vision of eradicating the second human disease on Earth, the first one being smallpox. Tremendous efforts have been done all over the world to stop transmission of wild polio virus. So today, for example, in 2015, we only have 2 countries which have never succeeded in stopping endemic transmission of wild polio virus, and those countries are Pakistan and Afghanistan.
Regions of the world that have been touched by war and conflict are of particular concern to public health officials, as they provide many of the conditions that can cause these outbreaks. While it's the loss of life and destruction of property that is the focus of headlines, the disruption to vital healthcare services and places where regular immunisation programs would normally take place, including schools, has seen some of the remarkable gains made against this disease become threatened at a time when the total and permanent eradication of polio is within reach.
It's important to realize that Syria and Iraq and many countries of the region have traditionally had extremely high coverage in routine immunization, which is basically the usual traditional way of providing multiple vaccines to children under the age of 1. And so before the crisis in Iraq and Syria, immunization coverage was more than 90% in those countries. However, with the onset of the conflict, the civil war, and the destruction of a lot of the health infrastructure, the movement of even healthcare workers out of those areas have led to a very fast drop in the coverage.
The reappearance of poliovirus and its importation from Pakistan to the Middle East in 2013 was a real crisis and emergency. It happened in a context which was really in favor of propagation, of transmission, and we were expecting a big outbreak. The virus moves with people. Transmission is facilitated by population movement, and this was the case with the IDPs and refugees. Also, poor population immunity encourages transmission, and many children were deprived from their routine immunization for some time, and this was reflected on deterioration in vaccination coverage.
The last outbreak in northern Syria paralyzed 36 children in Syria and 2 in Iraq between October 2013 and April 2014. Despite the worsening conflict, declining immunization rates in conflict-affected areas, and mass population displacement of Syrian refugees, no new polio cases have been reported in the Middle East for the past 18 months.
Although the virus intensity has decreased, there is still a potential risk of virus. Until it is present in Pakistan and Afghanistan, there is always risk to other countries. For example, the Middle East, which was polio-free since more than 10 years, it got the polio virus in 2013. And why? Because there were a number of factors which made the transmission of virus possible in this region. One of the factors was the low population immunity. The children were getting vaccines through the routine programs, but since the region did not have virus for a considerable time, the intensity of national or supplementary immunization campaigns was decreased. Another reason was that the focus on AFP surveillance, that also got a little bit lost from the time since the region did not have any case. So the indicators started getting a little lower than what is expected.
We didn't only focus on campaigns, but at the same time improving routine immunization, because it's a long-term strategy, but also as enhancing surveillance activities to make sure we are detecting cases on time. And because surveillance is the compass that guides all the immunization activities, and as well all the communication campaigns were taking place.
Representatives from governments and the Global Polio Eradication Initiative met in Beirut on World Polio Day to review the last outbreak response, and attributed the success in its containment to the swift and collaborative intervention and response in the Middle East, which saw over 27 million children vaccinated multiple times, and has been described as one of the most well-coordinated and intensely focused outbreak response efforts ever seen in the history of eradication programs.
We started with a plan for the first phase. So we passed through the response in phases. Each phase was initiated with a detailed plan, including all the countries in the region, and this was followed by ongoing monitoring and proper evaluation at the end of the phase for adjusting the strategies and developing new plans for the following phase.
So the program is actually implemented at a very grassroots level by the vaccination teams. Vaccination teams go from house to house and make sure that every child in their specific area is vaccinated. Each team is supervised by a supervisor. So 5 or 6 teams has a supervisor, and then this supervisor has another layer of supervision, which is called a zonal or a sub-district level staff. And then there are district level supervision, there is a provincial level, and then there is a national level. So there are multiple layers of supervision on these vaccination campaigns.
One of the key successes in actually reaching those children, despite all the challenges and the debilitated infrastructure and also the ongoing conflict, is the fact that traditionally communities in these countries have been accepting and demanding vaccines. They were referred to as vaccination nation. So everyone wanted the vaccine, wanted to protect their children. They felt that responsibility, and that doesn't go away. And we were really lucky to have that. If we didn't have that, we would be in a completely different situation today.
There is no known cure at present for polio. It can only be prevented. The polio vaccine, given multiple times, can protect a child for life. And according to experts, it is the only safe, effective and easily administered vaccine available. And access to it is the right of every child.
So we're not saying we're done, we're going to pack it up and go home. We're saying we're going to continue with the same momentum, with supplementing the campaigns, these supplementary activities, but as well as going back to strengthening routine immunization. So going back and trying to see how can we improve our coverage in routine immunization in some of these countries.
We cannot rule out the possibility of reintroduction of virus. So long as we have virus circulating in Pakistan and Afghanistan, we know there has been a lot of progress in the remaining two endemic countries. And we hope global eradication will happen soon, but so long as we have virus there is risk on any country.
The job is not done yet and will not be done until we eradicate polio off the face of the earth. That virus can come back.
In the region, up to 700,000 children under the age of 5 are not reached on a regular basis by the polio vaccine, and the risks that led to the last outbreak remain. There is now a historic opportunity to rid the world of polio, and while there is still one child at risk, complacency at this time could be disastrous.